ADHD, attention deficit hyperactivity disorder, is more than just a buzzword or a label for restless kids. It's a real neurodevelopmental condition that affects how the brain manages attention, impulses, and activity. In India, where academic and social pressures run high, understanding ADHD is crucial. Too often, children are called naughty or dull, and adults are seen as careless, when in reality, their brains are simply wired differently. ADHD isn't a sign of laziness or bad parenting. It's a difference, not a deficit. Imagine trying to watch one TV channel, but the remote keeps flipping to others on its own. That's daily life for many with ADHD. Their struggle isn't about willpower. It's a constant battle to focus in a world full of distractions. This invisible challenge affects school, work, relationships, and self-esteem. Globally, about 5% of children and 2.5% of adults have ADHD. In India, it could be as high as 11% among school children. That means in a typical classroom, several students may be silently struggling. These aren't just numbers. They're real people whose potential is often overlooked. By talking openly about ADHD, we can break the stigma and help more people get the support they need. Recognizing the neurological roots of ADHD is the first step toward empathy. It's time to move beyond stereotypes and see the person behind the symptoms. With awareness and understanding, we can empower those with ADHD to thrive. The journey starts with education, not judgment. Let's change the narrative. ADHD is not a weakness, but a different way of experiencing the world. Every mind deserves to be understood. Together, we can make that happen. ADHD isn't the same for everyone. It comes in three main types. First, the inattentive type. Trouble focusing, forgetfulness, and losing things often. These individuals may seem daydreamy or distracted, but it's not a lack of effort. Second, the hyperactive impulsive type. Always on the move, fidgeting, blurting out answers, and acting without thinking. This isn't defiance, it's a need for movement and quick reactions. Most common is the combined type, mixing both inattentive and hyperactive symptoms. These challenges must be persistent and disruptive, not just occasional forgetfulness or restlessness. ADHD symptoms show up in multiple settings: home, school, work. They interfere with daily life and development. It's not a character flaw, but a brain-based condition. Compassion and strategy, not punishment, are key. Understanding these symptoms is the first step to effective support. Everyone has off days, but for those with ADHD, it's a daily reality. Recognizing the difference matters. ADHD is often seen as a childhood issue, but it's lifelong. In kids, hyperactivity is obvious: climbing, running, interrupting, and struggling in school. Socially, impulsivity can make friendships tough. As kids grow into teens, hyperactivity may turn inward. Restlessness, fidgeting, and feeling overwhelmed by school demands. Procrastination and emotional ups and downs become bigger hurdles. Many believe kids outgrow ADHD, but most carry symptoms into adulthood. For adults, hyperactivity is internal. Racing thoughts, multitasking, and constant restlessness. They often struggle with planning, organization, and time management, leading to missed deadlines and stress. Relationships and careers can suffer, and self-esteem may take a hit. Many adults with ADHD also face anxiety or depression, often from years of misunderstanding. Recognizing ADHD as a lifelong condition is vital for ongoing support. The challenges change, but the need for understanding remains. Early recognition and support can make a world of difference. ADHD isn't just for kids. It's a journey through every stage of life. Diagnosing ADHD isn't as simple as a blood test. It requires a thorough evaluation by a qualified professional: psychiatrist, psychologist, or pediatrician. The process involves ruling out other causes, gathering information from parents, teachers, and sometimes the individual themselves. Standardized questionnaires help assess behavior across settings. Symptoms must be present for at least 6 months and start before age 12. In adults, diagnosis relies on personal history and input from close family or friends. In India, stigma and lack of awareness can delay diagnosis, especially outside big cities. Making diagnosis accessible and stigma-free is essential for timely support. ADHD isn't caused by bad parenting, sugar, or screen time. It's a brain-based disorder with strong genetic roots. If a parent has ADHD, their child is much more likely to have it too. Genes affecting dopamine, a key brain chemical, play a major role. Environmental factors like prenatal exposure to alcohol, nicotine, or lead, and premature birth can increase risk. These are risk factors, not direct causes. In India, nutritional deficiencies and toxins may also play a part. Social factors like family structure don't cause ADHD. Understanding the science helps shift blame away from families. Support starts with knowledge, not judgment. ADHD is treatable, and a combination of strategies works best. Medication, mainly stimulants, can help improve focus and reduce impulsivity. Non-stimulant options exist for those who need them. Behavioral therapy is crucial, teaching skills for organization, routine, and emotional regulation. Parent training and cognitive behavioral therapy, CBT, are effective for kids and adults. Lifestyle changes, structured routines, good sleep, balanced diet, and regular exercise make a big difference. Exercise and mindfulness practices like yoga can help manage symptoms naturally. Treatment isn't about curing ADHD, but empowering people to thrive. The right support can transform lives. Every person's treatment plan should be individualized. In India, ADHD brings unique challenges. Academic pressure and rote learning clash with the ADHD brain's need for novelty and movement. Kids are often mislabeled as weak or lazy, damaging their confidence. Socially, impulsivity is misunderstood as disrespect, leading to isolation. Workplaces can be chaotic, making organization tough for adults with ADHD. Missed deadlines and forgetfulness can hurt careers. The biggest struggle is often internal, feeling out of sync and exhausted from masking symptoms. Shame and silence are common, as mental health remains taboo. The journey is tough, but understanding and support can lighten the load. Change starts with empathy and open conversation. Supporting someone with ADHD starts with education and empathy. Learn what ADHD is and isn't, to move past frustration and toward understanding. For children, structure and routine are essential. Break tasks into small steps, use checklists, and praise effort, not just results. Positive reinforcement builds self-esteem far better than criticism. For adults, clear communication and gentle reminders help. Share calendars, use visual aids, and help organize daily essentials. Celebrate their strengths, creativity, energy, and unique perspective. Be patient. There will be tough days and forgotten tasks. Offer help without taking over, and encourage seeking professional support. Practice patience and choose your battles. Remember, managing ADHD takes invisible effort every day. Your support and belief can make all the difference. Be an ally, not a critic. Acceptance and encouragement empower people with ADHD to flourish. Together, you can build a bridge to success. ADHD isn't just about challenges. It's also about unique strengths. Many with ADHD are creative, energetic, and innovative thinkers. Their ability to hyperfocus can lead to extraordinary achievements. Michael Phelps, the world's most decorated Olympian, turned his ADHD into a strength through swimming. With the right support, people with ADHD can excel in any field. In India, awareness is growing, and more schools and workplaces are embracing neurodiversity. Technology offers new tools for organization and support. The conversation is shifting from what's wrong to what's possible. With diagnosis, treatment, and support, ADHD can be a journey of empowerment. Embracing differences leads to self-discovery and growth. To everyone with ADHD, you are not alone. There is hope, help, and a future where your strengths can shine. Let's celebrate every mind, because different is powerful.